Ideal chin implant. What are the general guidelines for chin proportions in men? I know it's a matter of shape and nose size, but I'm just asking for the general guidelines. I don't want an unbalanced chin or for it to be too prominent. I like the chin shape of the model in the picture. I'm not sure whether I want my chin a few millimeters behind lip line or at the lip line. I'm worried that bringing it up to the lip line will create a too mannish look.
Thank you for your question. You submitted your question with a photo of a model, and you also provided photos of side views of yourself to essentially ask the question, what is the ideal proportions when it comes to chin enhancement in men? And certainly you've done your research and you've learned a lot about the relative projection of the chin up to the lip, behind the lip, or in front, and you want to see what we as doctors use as guidelines to help you make a decision about chin implant size. And of course you have concerns about not of getting the ideal and not to look, quote, too mannish from a stronger projection. Well, I can certainly share with you how I have this type of discussion with the patients who come to see me in practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Chin implants and facial implants has been a big part of my surgical practice for many years, and in the last few years, even further, the use of long-lasting thicker fillers for comparable augmentations has also really opened up the opportunity to help my patients of all ages non-surgically. So thinking about balance and proportion is something I do all day long in my practice. So to begin with, I will certainly share with you some basic guidelines that we as doctors use. We actually, for decades, have been analyzing faces to look at what is ideal, and there are basically general guidelines, and we use lines and they have many names like Steiner's lines, Ricketts line, the Franfort plane, and the vertical lines, and basically looking at relationships between the nasal base, the lips, the chin projection from a side view. Also, when you look at a person in the front, you look at width of the chin and the relative balance. And interestingly, we look at this, of course, taking into consideration something I've always been a proponent of, which is looking at ethnicity. And even with that factor added in, it is something that is almost universally appreciated, that certain ratios are very much attractive across ethnicities. You've probably heard of phi, or the golden ratio of 1.6 to 1. And these are relationships within the attractive face that plays a role in what we as people look at. When we look at someone, we obviously don't make calculations, but we get an impression and a perception of what is balanced and attractive. And so certainly for men, a, quote, strong chin is something that's desirable. So as far as general guidelines, I can tell you that in my practice of 20 plus years, when I'm doing a chin implant, for most women up to a certain height, I will use a small chin implant. And when I talk about small, I'm talking about a specific implant that's referred to as an anatomical chin implant. And what that means is that the shape of the implant is in a way tapered so that it fits just right on the mandible or on the chin in a way that looks very natural. And then when it comes to men, generally speaking, I end up using a medium-sized chin implant. Now during surgery, we use something called sizers, and these are basically implants that are not meant to stay in, but are used to allow the surgeon, and in my case myself and my staff, to look at what the projection and shape looks like before settling on which implant to place permanently. Now, that being said, that may still be a challenge for you to commit to, especially if you really are not sure. And so a lot of times in my practice, I will tell patients like yourself that we can do something called structural volumizing. Structural volumizing means placement of thicker fillers, such as Juvederm Ultra Plus or Juvederm Voluma, at the bone level using special techniques that allows me to create augmentation that can be comparable to surgical implantation. Further, because we're using fillers, and if we want to achieve a certain shape, we also have the option of not only placing the material at the bone level, but we can also place it at the deep soft tissue level, the superficial soft tissue level, and we can use multiple different fillers. It gives us almost infinite options as to the number of ways we can do what is essentially sculpting. And a lot of times for someone who isn't quite ready for surgery, I think that's the better choice, because it is certainly a lot more involved to undergo a surgical procedure, wait for swelling to resolve, and then decide whether or not you want something different, and that's not always a good time. But when it comes to somebody who is still not quite sure or wants to see some variation, injectable filler can actually be not only an option as a trial, but can also be a solution that can be applied with some regularity. Thanks to the placement of these fillers and the type of fillers they are, these results can last for over a year and even up to 2 years. And that can allow for a lot of flexibility. So in fact, there are many people who aren't interested in having surgical correction for these types of desires, and injectable fillers just basically opens up the chance for many people who wouldn't do surgery to get this type of result, or at least a comparable result. So I think that you can overanalyze anything, and doing what we do, we see this all the time. Patients often miss the forest for the trees. And I would say that we are dealing with a zone that we can refer to as just simply art, and the art of seeing what is ideal and proportional for you. And as long as we have a shared understanding, we can start with injectable fillers. Otherwise, I would say that certainly you're in the zone if you allow for a certain range of projection to be something that you would be fine with. And certainly from that respect, a chin implant procedure is pretty straightforward, and it can be a long-lasting solution for you. So meet with qualified, experienced cosmetic surgeons who offer both injectables and implants, and see what you're comfortable with. I think that judging by the question, I think it's better probably. My impression is that injectable fillers might be a good way to get your sense of what you look like without committing to surgery first. So I hope that was helpful. I wish you the best of luck. Thank you for your question.